Let's now move from education to health. The chair of the Council of Governors, Peter Munya, has now turned the heat on the national government, accusing it of underhand dealings in the ongoing health crisis. Munya is accusing the government of misrepresenting the role of county government in managing the devolved function. Kyallo has the details.
The Meru governor now claims that the national government is behind a grand scheme to have the health functions returned back to the national government. He says that reliable sources have informed him that officers in government have been funding health workers' unions to instigate strikes and portray counties as unable to handle the docket.
The instigated strikes that are clearly being done and run by the Ministry of the Ministry. They are the ones who have been instigating the strikes. It is not an accident that the officials who are instigating strikes in the country all work for the national government.
Munya also accused the national government of frustrating the devolution of health, saying despite the constitution giving the function to the counties, the Ministry of Health was still holding 200 billion shillings meant to have been disbursed in the counties. He slammed Health Cabinet Secretary James Macharia for accusing counties of failing to deal with the health sector.
If the money was there, I'll be the first to sign off, because I've seen the conditions you're working under. And for me, we shall continue advocating, we shall continue interceding on your behalf to make sure that you get the best terms of service.
Is he a promoter of trade unions? Does he sit in the trade union boards? Why is he giving them comfort?
Members of the Wiper Democratic Movement have also come out to oppose the returning of the health function to the central government, saying efforts by the counties to efficiently deliver services have been previously undermined by it.
But demands the release of funds to counties and supports the Senate to ensure that resources are made available for the discharge of this function.
However, the Central Organization of Trade Union Secretary General Francis Atwoli accused governors of sabotaging the health sector in the country by deliberately diverting money meant to pay health workers to other political projects.
It requires national attention, national monitoring, national authority, national authority supported by government to take care of the interests in the health sector, including to negotiate with the unions under health sector.
But as the war of words rages on, patients in hospitals in areas affected by the strike continue to suffer. Nurses in Nyeri, Eldoret, Trans-Nzoia and Nandi have kept off work for the last 2 weeks, saying they will not budge until money is in the bank.
Let them advertise, let them do what they can, because even those people they are going to employ will need salaries. If they cannot pay us, where are they going to get the money to pay those they are employing?
The sector has been hit by turbulence since the year started, with perennial strikes and breakdown of services. More than 20 people have so far lost their lives following the unrest. Kyallo, KTN News.